Okay, next to speak is Sally Cheshire, who is chair of the HFEA.
Thank you very much. I did want to go last, but I'm not allowed to, so I'm second, because I'm the non-clinician, but hold the very important role of chair of the HFEA. And my talk is about responsible innovation, which we launched at our conference around 2 weeks ago. It's time for the sector and everybody else to step up to the plate on add-ons. So back in August 2016, before the Panorama and BMJ articles that Adam referred to, we did our own equally evidence-based survey of clinic websites, which showed a number of things, and it's important to recognise that it wasn't particularly evidence-based, but it was a good survey of the websites of people in the sector. So the information varies greatly as to what clinics offer in terms of information, as does the price charged, and I've got a graph later which looks at the most the most common interventions and how much is actually charged by a range of clinics. There is a lack of transparency when treatment packages are offered, because it's very hard to get a price for some of those individual treatments as part of a full range of IVF or ICSI. We know that 70% of UK clinics offer at least one of the common add-ons. So that's not everybody, that's 70%. But interestingly, they're especially prevalent in London and in private clinics. So if you go to a private London clinic, you're probably much more likely to be offered something. And perhaps that talks about the market, and perhaps that talks about the evidence base. Clinics' openness about evidence and the effectiveness varies greatly. And Adam referred to EmbryoScope. We had a couple of quotes, and I won't fulfill them in detail, but the first one said, there is quite a lot of evidence to show that EmbryoScope works, that it allows you to select better embryos, that it allows you to, in selecting those embryos, not necessarily implant as many embryos back and therefore reduce the probability of a multiple birth. Cost £500. A second clinic talked about EmbryoScope in terms of its effectiveness and said that wasn't conclusive, but they were prepared to offer on some promising evidence to all patients, free of charge, whether they were NHS funded or private, the use of an EmbryoScope until that evidence existed. That is a very important but a very subtle difference. So, where do the HFEA stand? We want patients to have the best chance of a healthy baby, only being offered treatment which suits them and which improves their chances. And different treatments, different treatment pathways, as you know, are suitable for different patients or different couples. We want people, we're not against innovation, we want people to have access to new treatments and add-ons at a reasonable price. And we want them to be prepared for any treatment they might undergo with good evidence-based information. Good evidence-based information. Treatment add-ons, of course, aren't new. And I was at the Fertility Show at the weekend where I listened to a talk that John Parsons did, talking about reproductive immunology and pre-implantation genetic screening, or PGS, being around 20 years ago. I remember being offered it as a patient more than 15 years ago. And they're not new. But recently we've seen a step change in their use, and that's why, as Adam said, we've been working with the professional bodies, the RCOG, the BFS and ACE, on guidelines and on gathering information about who uses add-ons. This is a piece of work that the HFEA published, which various people have used in their talks at the Fertility Show. So our scientific and clinical committee, called SCAC, did some work which was published back in February, where they looked at the 9 most common add-ons and concluded that if it was rated red, amber or green, red meant that there was little evidence at the moment of effectiveness. Amber means that there may be some promising results, but not enough evidence yet to draw a conclusion. Very few trials, if any at all. Green, and you'll notice the absence of green, would be where more than one high-quality clinical trial has produced evidence of an improved outcome in clinical treatment. And some of those might be verging on green, but they're not there yet. So if you actually look at the top 6, they are ordered in terms of, at the top, how many clinics offer them, with the most popular, and what the range in price is, which is quite astonishing, isn't it? Particularly when none of those have high-quality clinical trials behind them and are being charged for quite high amounts. The little star means that you might offer those treatments as part of a package, and therefore it's hard to know what they cost. Happy to come back to some of those, but that's our screen for now. Okay. We are absolutely committed to addressing this issue by starting with the SCAC results and taking those forward, publishing and promoting clear information for patients on our website about evidence. Our new website will be available in a few short weeks once we've dealt with the legal matter, and that information will show much more evidence of information about the top 9 and further ones that SCAC might consider, and that will be ongoing. We absolutely need to understand more about what patients think, and we are undertaking a survey with Fertility Network UK over the next couple of months to get more patient feedback on what they're being offered and how they feel. We have launched a campaign with the support of the professional bodies, and both Adam, as chair of the BFS, and Jason Casray, chair of ACE, pledged support to the campaign. Leslie Regan has also pledged her support, and we will be launching that over the next couple of months and into the summer once our website is available. It's absolutely the time to step up, and it is the time for everybody to work together. By October, over the coming months, we will have strengthened our guidance to clinics about what they should tell patients, because a good regulator has high-quality information on its website. It instructs clinics to have high-quality information on theirs, and you might argue that's variable at the moment. And the good regulator then brings people together to make sure that we are operating. We have limited powers at the HFEA, and I know that's been part of one of the articles in the press this morning. Limited powers because we don't regulate drugs, surgical procedures, or lab equipment. And Adam is absolutely right when we refer to all of these things as add-ons. Some of them are medicines, some of them are surgical procedures, some of them are lab equipment, one of them is part of culture medium. So they are all very different, but what we can do is work on the cause for persuasion, to make everybody in the sector step up and stop offering patients treatment that isn't evidence-based. What we will do at the bottom is monitor research, through our SCAC committee, who will now do an annual or more regular review, if needed, of all of the regular add-on treatments that are offered in clinics. Okay. Finally, our strategy to 2020 defines responsible innovation. I hate the word add-ons. This isn't about add-ons. This is about responsible innovation in clinics that's evidence-based to improve patient outcomes. So we will publish information to be clear on which add-ons are effective and safe, and I do hope that at some point in the future there are some green ones. We are encouraging more research to improve the evidence for new treatments, and at our conference it was really interesting when we raised the point about consent to research and what percentage of patients in every clinic have actually consented. The range is from 0 to almost 100, and the average is currently about 70. Which is an improvement on recent years. When we asked clinics whether they were prepared to know what their consent to research rate is, and lots of people didn't know, everybody said yes. That is a big step change forward that says if you want to know about how many patients you are recruiting to research, with no forcing them to do that, then that is a big step change to allow us to, if the funding isn't there, take clinical trials forward.
Sally, can I wind you up there, please?
Yeah, Adam had 2 extra minutes, so
that
I'm
was
going to
'cause I
continue.
didn't see
We are going to guide clinics to offer add-ons in a responsible way, and we will continue to test patient opinion. For those of you who've been involved in our multiple births campaign, one at a time, started by the Multiple Births Foundation with Jane Denton, but has involved an awful lot of stakeholders from right across the sector, has been a fantastic public health story in reducing the percentage of multiple births from around a quarter down to about 13% with a target of 10. That is a great public health story, and our experience shows that in the absence of legal or other levers, collaboration absolutely works. So we are really clear at the HFEA what we stand for and how we are going to take this forward. It's not just about add-ons, it's about responsible innovation. And my challenge to the people here, who are very supportive, these three have offered to sit in the chair and talk from a clinician standpoint when hundreds of other doctors haven't. So credit to them for pledging their support and taking this forward. Are you with us? Thank you.